A very good morning, friends. As you know that from last week we have started the health awareness programs, and we have covered the depression, thyroid, diabetes, gout. So these are very essential. So people should know all about this. And today I just wanted to cover our major issue and the major disease, that is cancer. Since you know that cancer is an uncontrolled growth of abnormal cell anywhere in the body. There are 200 types of cancer. Anything that may cause a normal body cell to develop abnormally potentially can cause cancer. And general categories of cancer that is related or causative agents are as follow, like the chemicals, the toxic compounds, some radiations exposure, ionizing radiation, as you know that some of the pathogens, and human genetics as well. Okay, so cancer symptoms and signs depends on the specific type of cancer and the grade. Although general signs and symptoms are not very specific, the following can be found in patients with different cancers, like fatigue, weight loss, pain, skin changes, or even like a bladder function, unusual bleeding, persistence of cough, the voice has changed, fever, lumps in the body parts, and the tissue masses. All right. Although there are many tests to screen and uh, presumptively diagnose the cancer, the definite diagnosis is made by examination of biopsy sample of suspected cancer tissue. Okay. Cancer staging is often determined by biopsy, as I just told, results and helps extent of cancer spread, and the staging also helps caregivers or caretakers to determine the treatment protocols. So that all depends on the stages. So in general, in most staging is methods, if we see, the higher the number of assigned, usually between 0 to 4, the more aggressive the cancer type and more widespread is the cancer in the form in the body. So a staging method differs from cancer to cancer and needs to be individually discussed with your healthcare provider, your specialist, your doctor. So the treatment protocol, if we talk about the treatment protocol, that varies according to the stage and the type of cancer. Most treatment protocols are designed to fit the individual patient disease. However, the most treatment includes at least one of the following and may include all, like surgery, chemotherapy, radiation therapy, and the adjuvant therapy as well. So there are many listed home remedies and alternative treatments for the cancer, but the patients are strongly recommended to discuss this all their this all the things before use with their cancer doctor. So you just going for the home remedies, but you need to consult with your doctor. That is very much required. So if we talk about the prognosis of the cancer, can range from excellent to poor. The prognosis depends on the cancer type and its stage with those cancers known to be an aggressive and those stages with higher numbers often have prognosis that ranges more towards poor. Okay. So as I told, it's an uncontrolled growth. Cancer is an uncontrolled growth of abnormal cells anywhere in the body. These abnormal cells are termed to be a cancer cell, the malignant cells and the tumor cells. You are very much aware of this. These cells are infiltrate normal body tissues, and many cancers and the abnormal cells, as you know, that they compose the cancer cell, are further identified by the name of the tissue that the abnormal cells originated from. For example, breast cancer, if it is originated from the breast, lung cancer, colorectal cancer, okay, mouth cancer, oral cancer. So cancer is not confined to the human. Animals and other living organism can get cancer. See, below is the systematic that shows the normal cell division and how when a cell is damaged or alter, how when a cell is damaged or alter without repair is damaged. So altered without a repair to its system and the cell usually dies. So in that condition, what occur when such a damage or unrepaired cell do not die, and it becomes like cancer cells and show uncontrolled growth in the body. So it multiplies very fast. A mass number of cancer cells develop, and frequently these cancer cells can break away from the original mass of the cell, away from its original mass, and travel throughout the blood, lymph system, lodges in other organs, where they can again repeat the uncontrolled growth of like this growth cycle. And this process of cancer cell leaving an area and growing in another body area is termed to be as metastatic spread. Okay, for example, I'm just giving you, if breast cancer is cell spread to a bone. For example, I'm just giving the example, अगर breast cancer के cells हैं वो spread हो रहे हैं bone तक, it means that the individual has metastatic breast cancer to bone. This is not the same as bone cancer. So which would like mean the cancer had started in the bone. Okay. Now I'm just giving another example. Now comes to the, somebody has asked the question, what are risk factors and causes of cancers? See, uh, anything anything that may cause a normal body cell to develop abnormally potentially can cause cancer. Many things can cause cell abnormalities and have been linked to a cancer development in our body. Okay, so some cancer causes remain unknown, while the other cancers may develop more than one known cause. How? Some may be developmentally influenced by a person, by their genetic makeups. Many patients, like, they develop cancer due to the combination of these factors, although it is often difficult or impossible to determine an initiating effect that cause of cancer to develop in a specific person. Research has provided our clinicians with a number of likely causes that alone or in concert with other causes are the likely candidate for initiating the cancer. The following, I'm just giving the examples, major causes and the specific causes are what like they supposed to be, which ultimately leads to a cancer. So like chemical or a toxic compound exposure, am I right? So in this, benzene, asbestos, nickel, cadmium, vinyl chloride, nitrosamines, tobacco, cigarette smoking. This contains at least, 66 known potential carcinogenic chemicals and toxins, and asbestos and aflatoxins, which is very much hazardous for our health. That ultimately leads to the cancer because it is cancerogenic in nature. Okay. Second, I just wanted to add the ionizing radiations. If like the person who is working in that segment, there is a more exposure of ionizing radiations, what happen in such conditions, like uranium, radon, ultraviolet radiations from the sunlight, and the radiations from alpha, beta, gamma, x-ray emitting these sources. So they are the causes of, they are all the primary causes of cancer. So now moving towards the pathogen, very important, you should note this point. HPV, the human papillo, yes, human papilloma virus, human papilloma virus. Okay. EBV, Epstein Barr virus, hepatitis virus, B and C, Kaposi sarcoma, associated herpes, Merkel cells, polyoma virus. Uh, Other bacteria are being researched as possible agents for this. Okay, ये हम सभी को पता है. But what about genetically? Yes, this is also one of the factor. A number of specific cancers have been linked to human genes, and are as follow, like breast, ovarian, colorectal, prostate, skin, melanoma, and the specific genes and other details are beyond the scope of this general, whatever the mentioned by the National Cancer Institute. So yes, genetic causes there. I agree with that. So it is important to find out, point out that most everyone has some risk factor for the cancer, and in this like exposed to a cancer causing substances. For example, I already told the sunlight, the secondary agents like cigarette smoking, the X-rays. So during their lifetime, so but many individuals do not develop cancer. So in addition, many people have the genes uh, that are linked to a cancer but do not develop it. Why? It is also one of the question. Although researchers may not be able to give this satisfactory answer for every individual, but it is very clear that the higher amount or level of cancer causing agents material in a person is exposed to be a higher risk of susceptibility. Sorry. In addition, the people with genetic links to the cancer may develop it for a similar reason, like lack of enough stimulus to make the genes, uh, uh, what let's say, to makes the genes functioning. And in addition, some people may have a heightened immune system that also control or eliminates the cell that are or potentially may become cancer cell. So these are some of the factors which we can keep in a mind. Now the symptoms as sign of the cancer depends on the type of cancer, where is it located, or where the cancer cell have spread. So there are so many things relevant. Definitely, as I told, there are 200 types of cancer. So sign and symptoms vary accordingly. For example, the breast cancer, in this breast cancer may present as a lumps in the breast, as nipple discharge, while metastatic breast cancer, uh, in this condition, present the symptoms of pain. Okay, if it spread to the bone, it extreme fatigue, lungs, the same thing, and in a case of brain, the seizures. A few patients shows no sign and symptoms until the cancer has far advanced. So that's why the routine checkup is very much required after some age. Okay. So, as per the American Cancer Society, they describe several warnings and the symptoms in their articles that the cancer may be present, and which which shows a prompt a person to seek medical attention. The he has the board has given help you remember these points, like change in the bowel, bladder habits, a sore throat that doesn't heal. So this is also, you should note all this thing. So unusual bleeding and the discharge, for example, discharge from the nipples, secretion or the sore that will not heal, that oozes material. So this is the point, you need to be more attentive for yourself. So you cannot be an ignorant one. So thickening and the lump in the breast and the testicles elsewhere. Indigestion is also usually chronic or difficult in the swelling, so you need to more focus on also this parameter. Okay, obvious changes in the size, color, shape, and like thickness of the valves and the molds. I mean, each and every body part. And if you see some your moles has the size change, your breast is having size change. So you need to know that self examine is very much required. You can go to in front of the mirror. You can give a time. You can observe yourself what changes you feel inside your body. So this is very much required. Don't be shame. Like um, it is your body, you need to examine it properly. Okay, nagging cough and the hoarseness. See, other signs and symptoms may also alert you and your doctor to the possibility of you having some form of cancer. This I'm just including this also. uh, the loss of weight, loss of appetite, a new type of pain I told in the bones and other part of the body that may be steadily worsening and come and go, but is unlike previous pain one has said before. So it's you should not ignorant of this pain. Okay, so persistent fatigue, nausea, vomiting. You need not to avoid this point. Recurring infections which will not clear with the usual treatment. So anyone with this sign and symptom, my dear friend, you need to consult with your doctor, because these symptoms may also arise from non-cancerous conditions, and many cancer will present with some of the above general symptoms, but often have one or more symptoms that are more specific for the cancer type. For example, I'm giving the lung cancer may present with common symptoms of pain, but usually the pain is located in the chest. The patient may have unusual bleeding, but the bleeding usually occurs when the patient cough. Lung cancer patient often become short of breath and then become very fatigued. So because there are so many cancers type with so many non-specific, sometimes more specific symptoms, the best way to learn about the sign and symptoms of any of this specific cancer is to spend few moments to examine your body particularly which is required. Conversely, a specific body area can be searched to discover what sign and symptoms a person should look in that area that is suspected of having cancer or not. So so again I am just giving the examples are the two ways to proceed to get the information or the symptoms. So in that way I come up with use you need to be more focused. See, now the question is what are the different type of cancers? So Preeti madam has already told the sign and symptoms. Okay, this different types of cancer, as I told, there are around 200 types of cancers, for too numerous to include in the my session. So, however, I listed, figure out some of them. I just discussed with in a short ample of time. See, the carcinoma. First, carcinoma that's benign in the skin and in the tissue that lines or covering your internal organs, skin, lung, colon, pancreatics, your ovarian, uh, epithelial, squamous cells, basal cells, carcinomas, melanomas, and papillomas and adenomas. Got it? Okay. Second, I just wanted to say sarcoma, cancer that benigns in the bone, cartilage, fat, muscles, blood, vessels, or other connective or supportive tissue, bone, soft tissue cancer, osteosarcoma, synovial sarcoma, liposarcoma, angiosarcoma, your rhabdosarcoma, and fibrosarcoma. Okay, shall I repeat? First, I told you carcinoma. That carcinoma is that cancer that begins from the begins in the skin, like epithelial cell, squamous cell, basal cell, and your melanomas and all these things. Sarcoma that begins in the bones and the cartilage, means the connective tissues. Now, third is leukemia. That's relevant to your blood. Leukemia, cancer that starts in the blood forming tissues such as bone marrow, am I right? Such as that causes a large number of abnormal blood cells to produce and enter the blood. Leukemia, lymphoblastic leukemias, it's like myelogenous leukemias and T cell leukemia, hairy cell leukemia. Okay, now fourth one is lymphoma. First carcinoma, sarcoma, leukemia. Now fourth one is lymphoma. I thought I'm not getting you bored. Okay. So if you feel any time in between, I can just stop my session. We can continue some other day. Okay, okay. You are comfortable with that. Okay, thank you. So lymphoma. Uh, let me tell you, the cancer that begins in the cell of the immune system. जो हमारे इम्यूनो सिस्टम से मतलब स्टार्ट होता है, दैट इज लिम्फोमा. ओके, तो इसमें क्या आ जाएगा? टी सेल लिम्फोमास, बी सेल लिम्फोमास, हॉचकिन लिम्फोमास, नॉन हॉचकिन लिम्फोमा, लिम्फो प्रोलिफरेटिव लिम्फोमास. ओके, now comes to the central nervous system cancer. Yes, exactly. The central nervous system cancer, and this cancer starts or begin in the tissue of the brain and our spinal cord. brain and spinal cord tumors, gliomas, meningiomas, pituitary, pituitary adenomas, okay, vestibular CNS lymphomas, and primitive neuroectodermal neuroectodermal tumors also. Okay, so I just go with all this thing. Now comes to the facts, like I'm just discussing uh, in not included in the all about the like mention I just mentioned this various cancers, metastatic cancers. This is because the metastatic cancer cell usually arises from the cell type uh, which I discussed. And the major difference from other types is that this cell are now present in the tissue from which the cancer cell did not originally develop, and that consequently, if the term metastatic is used for the accuracy, the tissue from which the cancer cell arises should should be included. For example, I'm just giving you the example. Uh, in this condition, uh, uh, like you have heard that incidents. A patient, if a patient may say that they have or diagnosed with metastatic cancer, but the more accurate statement is metastatic. For example, breast, lung, colon, and other type cancer with a spread to the organ in which it has been found. So another example of the same, a doctor describing a man with prostate cancer has spread to his bones should say man has metastatic prostate cancer to the bone. This is not bone cancer, but which would be cancer that started in the bone cells, and metastatic prostate cancer to bone is treated differently than lung cancer to bone. Okay, now okay, I'm just taking the questions one by one. Again, you guys have the questions, you can write in the chat box. Okay. Okay, one question I received. How do physicians determine cancer staging? Exactly, because this is very much needed when some patient has went to the doctor and suddenly he or she is showing the symptoms. I'm having the lumps in the breast. I have this problem. I also like feeling like fatigue, and these are the problems he or she is showing. Suddenly, doctor said it's a third stage. So like the person is completely lost, because what about the moral support, what about other aspects? So this question is asked by you. It's really fantastic, people should know. And how do physician determines the cancer staging? So there are number of different staging methods used for cancer, my dear friends. The specific staging criteria varies among cancer types, as I told you. um, According to the National Cancer Board, the common elements considered in the most staging system are like site of primary tumor. Okay, you should know the site of primary tumor. What is the tumor size, the number of tumors, the lymph node involvement, means the spread of cancer, the spread of the particular cancer to the lymph nodes, the extent and the cell type and the tumor grade, how closely the cancer cell resembles to the normal cell, ये पता होना बहुत जरूरी है. And the presence and absence of metastasis, it also been required. However, there are two main methods that forms the basis for their more specific or individual cancer type staging, the TMN staging. Again, I am repeating the TMN staging, which is used for most solid tumors, while the Roman numeral stage grouping method hai, which is used by some clinicians and researchers on like almost all cancer types they are using for this. ओके लेकिन जो टी एन एम सिस्टम बेस्ड हम यूज करते हैं ऑन द एक्सटेंट ऑफ द ट्यूमर, द एक्सटेंट ऑफ स्प्रेड टू द लिम्फ नोड एंड द प्रेजेंस ऑफ डिस्टेंट मेटास्टासिस। तो ये चीज हमें जानना बहुत जरूरी है। नंबर ऑफ एडेड टू ईच लेटर टू इंडिकेट द साइज एंड द extent of the primary tumor and the extent of cancer spread in the body. Higher number means the bigger tumor, more spread. So in that case, the TNM staging system क्या किस तरह से डिस्क्राइब करता है? लेट मी टेल यू। प्राइमरी ट्यूमर which is not I think cannot be primary tumor cannot be evaluated. T0, no evidence of primary tumor. So these are it's not like your use, but one thing I just wanted to say that you should be aware of the cancer whatever, so you should be examine your body parts the with the age, like it is very much required. Because since the post-menopausal woman also most susceptible to the breast cancer, which is also the second most leading cause of death. So it should not be the ignorant। हमें ये सब चीज़ों को इग्नोर नहीं करना है। वी नीड टू टेक सम ऑफ द एडजुवेंट थेरेपीज। You can work on your hormonal imbalance if you have, so you can balance that level also. See, and now comes to the what are the treatments of the what are cancer treatment options. So now with the techniques, now with the technological, we are in a technological world now. Pharmacy is a world, now India is a world of pharmacy. We have each and every operational measurements. We have solution of each problem. So cancer treatment is based on the type of cancer and the stages of the cancer. In some people, diagnosis and the treatment may occur at the same time if it is in the entirely if the cancer is entirely surgically removed, when the surgeon removes the tissue and for biopsy. Okay, although patient may receive a unique sequences treatment or a protocol for their cancer, most treatment have one or more full components like surgery. The patient should be on the chemotherapy, uh, radiation therapy also, or they are also on the combination treatment, combination of radiation therapy and the chemotherapy. uh, okay, so individual obtain variations of this treatment for the cancer. The patient with cancer that cannot usually get the combination therapy, the composition determined by the cancer type and stages. Okay. Second, I just wanted to add the palliative therapy. Now you have a question, palliative therapy. Um, treatment that is used to reduce the symptoms but unable to cure the patient. Utilize the same treatment that describes I already I described. Okay, it is done with the intent to extend and improve the quality of life of the terminally ill cancer patients. There are many other palliative treatment to reduce the symptoms such as pain, medication, anti-nausea medicines. It's something like medical care. Okay, now comes to the question is that like many people has they can't afford the treatment of cancer, so they used to and might they are used to with this, and many of them ask the question, are there home remedies or alternative treatment for cancer? Definitely. There are many claims on the internet. If you go through that, for example, many claims we have, like broccoli, grapes, ginseng, soybean, green tea, aloe vera, lycopene, and the treatments like acupuncture, vitamins, dietary supplements. This you can consume. You can take more antioxidant foods, so which is required. ओके, सो गिलोय ऑल्सो ज्वार, हम ज्वार बोलते हैं, ज्वार, ज्वारे के आप जो लीव्स लेते हैं ना, आप उसको लो, उसका पाउडर लो, उसका जूस पियो, गिलोय का जूस पियो, ग्रीन टी ज़्यादा से ज़्यादा कंज्यूम करोगे, बॉडी से जो टॉक्सिन्स बन रहे हैं वो बाहर जाएंगे. ठीक है. Ginseng is good, one of the supplement you can use. Vitamins is very much required, whatever the condition. Your vitamin level should be maintained. Okay, so dietary supplement also, yes, play a crucial role. Okay, almost every physician, if I'm talking about, they suggest a balanced diet and a good nutrition with help, which helps the individual to combat from the cancer. Okay, although some of this treatment may reduce the symptoms at some level, there is no good evidence as such they can cure any cancer. Patients are strongly recommended to discuss any home remedies and the alternate therapies and with their cancer, with their doctors from beginning. So yes, you can use turmeric also, because the article has been reported. There are huge number of works, ongoing works on the curcumin. So it's good. You can consume turmeric. That is one of the good option. You can consume tulsi. These are the good home remedies I can give. I can also advise the turmeric, jowar bata, giloy, uh, and the aloe vera juice. These are good. Definitely it works. Vitamins and the lycopene, soybean, green tea, you need to consume more and more and more. That is required. Now the question has, many question has a problem. What is the prognosis for cancer? Obviously, bhai, if person is suffering from the cancer, his family, her family should know what are the outcomes, the hope that's required now. Prognosis is somehow the if I'm sparing 25 lakhs, the person is not having 25 lakhs, so what will be the guarantee? What is the outcome I'm able to give? But the what is the assurance? So that's required. So, my dear friend, I just wanted to add here, the outcome for cancer patient may ranges from excellent to poor. That depends on its condition and the stages. The prognosis is directly related to both the type and the stages of the cancer. Since I'm giving you the example of some one case I heard, which is very nearby me, like he's suffering from the the lung cancer. Their doctor has done some चीरा, कुछ वहाँ चीरा लगा के उन्होंने कर दिया. They started, उनका पस बनने लगा अंदर ही अंदर बॉडी में प्रॉब्लम होने लगी. प्रॉपर ट्रीटमेंट नहीं हुआ, डायग्नोस होना बहुत जरूरी. उन्हें यहाँ इस हॉस्पिटल रेफर किया, फिर दूसरा हॉस्पिटल, फिर तीसरा हॉस्पिटल. मतलब ऐसे करते करते टाइम निकलते गया. देन एकदम से वो मुंबई वाले हॉस्पिटल उन्होंने रिकमेंड किया, टाटा मेमोरियल. वहाँ पे भी अपॉइंटमेंट लेते लेते टाइम हो गया. तो क्या हुआ, टाइम हमारे हाथ से निकल गया. सो द एग्जैक्टली आज क्या है, वो व्यक्ति नहीं है हमारे बीच. तो हमें इस क्रुशियलिटी को समझना है, इतना इम्पोर्टेंस देना है. वी शुड नो. अगर हम आउटकम की बात कर रहे हैं, प्रोग्नोसिस की बात करें, डेफिनेटली उन्होंने 25 to 30 lakhs स्पेयर किया, बट द रिजल्ट इज जीरो. ही डाइड. So, my dear friend, I just want to add the things. You just take a serious note, whatever the terms and conditions and whatever the severity, whatever the symptoms you find, you just recommend to your doctor immediately. Okay, so when we are talking about the prognosis, the outcome, definitely it all depends on the condition and the stage and the type. Okay, for example, many skin cancer can be completely cured by removing the skin cancer tissue. Similarly, even a patient with a large tumor may be cured after surgery or other treatment like chemotherapy. Note that a cure is often defined by many of the doctors as a 5-year period with no recurrence on the cancer. But the same thing is happened with my grandmother, my mother's mother. मेरी नानी के साथ हुआ था. In that time she suffered from a breast cancer. What doctor has done during that time, they did the they did the surgery. They what they did, they removed the part. Okay, so after 5 years, it the same recurrence rate has been covered. So ultimately, she is no more, but the recurrence is there. So might be proper treatment is really required. Okay, so similarly, if we are talking the cancer type, either is or more aggressive with spread to lymph nodes, or is it metastatic to other body organs, the prognosis decreases. For example, cancer that have higher number in their stages, for example, stage 3, C staging section, and worse prognosis, and then those with low numbers, as the staging number increases, the prognosis definitely worsen and the survival rate decreases. So हमें stages पता होना very much required. So what I mean to describe in all this process is that uh, from introduction to till now to the cancer, consequently the details such as life expectancy. Life expectancy for each cancer cannot be covered. However, the cancer in general have decreasing life expectancy as the stages of the cancer increases. जैसे जैसे कैंसर की स्टेजेस बढ़ती जाएगी, हम एक्सपेक्टेंसी कम करेंगे, बिकॉज प्रोग्नोसिस उतना ही डिक्रीज होगा. So early stage detection is very much required. You note that. On the positive side, if we are talking cancers that are treated or do not recur, no remission within 5-year period, in general suggestion that the patient will have more normal life expectancy. So some patients will be cured and few others may get recurrent cancer. So unfortunately, there are no guarantee. So we need to work out ourselves in that point. So there are many complications that may I already discussed occur with the cancer. Many are specific to cancer type stages and too many numerous uh, uh, symptom signs I explained. However, some general complications that may occur with both cancers and its treatment protocol, I mentioned like fatigue, both due to the cancer, its treatment. The patient comes with the anemic, insomnia, hair loss, nausea, and it's a lymph lymphedema, pain, इम्यूनो सिस्टम डिप्रेशन. व्यक्ति का इम्यूनो सिस्टम बहुत ज़्यादा वीक हो जाता है बिकॉज दे आर मोर वरीड. एग्जैक्टली. So now the question is that, is it possible to prevent cancer? Most expert and the doctor who are in contact are always convinced that many cancer can either be prevented or the risk of developing cancer can be markedly reduced. Some of the cancer prevention methods are simple, other are relatively very extreme. That again depends on the condition. So cancer prevention by avoiding its हमें क्या करना है, जो पोटेंशियल कॉज है हमें उस कॉज को अवॉइड करना है. एंड इज द सिंपलेस्ट मेथड विच वी नीड टू अवॉइड. द फर्स्ट वी नीड टू फिगर आउट the cause, like many of consuming the alcohol, the smoking, tobacco, avoiding excess of sunlight, sunscreens, what people are using for glowing their skins and everything, they're using sunscreen. So you need to avoid that. Many of the chemicals, toxins are excellent ways to avoid the cancers. Avoiding contact with certain viruses, the pathogens, and also likely to prevent some cancers. People who have to work closer to the cancer causing agents, like the workers who are working in the chemical industries, they are in those who are used to with the x-ray technician, x-ray machines, ionizing radiations, UV radiations, the asbestos, should follow safety precautions and minimize the exposure. They need to follow the proper guideline that's required. There are two different vaccines currently approved by US FDA, as you know, that to prevent the type of cancer. Uh, like vaccine against hepatitis B virus, you, as you already know that, which is considered a cause of some liver cancer, and vaccines against human papillovirus, I told that type 16 and 18 are available. So what is required overall, if we are concluding our session, what is required? You need to figure out the cause of cancer, and you need to work out on that in an initial stage. And you need okay, after 35 years you start examine your body. In a week, in a month, give a time, close your room and give a time to look after your body. Is there any lumps in the breast? Is there any problem? Is there कहीं गठान तो नहीं बन रही है? ये चीज़ आप देखिए, क्योंकि भाई यही वो जगह है, हमारा शरीर ही वही जगह है जहाँ हमें खुद को रहना है. तो उस पर वर्क करिए. एक स्ट्रेस भी उसका कारण हो सकता है, तो वो भी आप फिगर आउट करके हटाइए. जी, क्वेश्चंस. एनी क्वेश्चन? Hopefully, yeah, that question I have given answer. Maximum questions I covered in a chat box, so I received. So, for a star to be born, there is one thing that must happen. A gaseous nebula must collapse. So, collapse, crumble. This is not your destruction. तो हमें अपने आप को ख़त्म नहीं करना है, हमें लड़ना है और उससे निकल के आना है. रिमेम्बरिंग दैट यू आर गोइंग to die is the best way I know to avoid the trap of thinking you have something to lose. You are already nagged. There is no reason not to follow your heart. So take risk. If you win, you will be happy. If you lose, you will be wise. तो मतलब मैं इस पॉइंट में नहीं बोल रही हूँ कैंसर को लेके, लेकिन आप रिस्क लीजिए. अगर अगर आपको लगता है ऐसा कुछ सिम्टम्स आ रहे हैं, उससे लड़िए, हिम्मत ना हारिए. क्योंकि आधे से ज़्यादा जो इम्यूनो सिस्टम है वो डगमगा जाता है और उसी के कारण सिवियरिटी हो जाती है. तो वो चीज़ हमको फिगर आउट करना है. अगर हम डर गए तो हम डर ही गए, तो वही हमारा आधे से ज़्यादा फेलियर हो जाता है. इट इज़ द डिफ़िकल्ट टू लाइक समबडी हैज़ टोल्ड, इट इज़ डिफ़िकल्ट टू से व्हाट इज़ इम्पॉसिबल. For the dream of yesterday is the hope of today, and the reality of, yes, reality of tomorrow. So yes, for tomorrow we need to work on today. पास्ट भूल जाए, प्रेजेंट को में बहुत अच्छे से जिए ताकि हमारा भविष्य अच्छा रहे. So what cancer cannot do? Somebody has asked. Cancer is so limited, my dear friend. It cannot cripple love. It cannot shatter hope. All right. It cannot corrode the faith. It cannot be eat away peace. It cannot destroy the confidence. It cannot kill the friendship. It cannot shut out your memories. It cannot silence courage. And the main thing, it cannot reduce your eternal life, it cannot quench the spirit. So जहाँ चाह है वही रहा है, जहाँ फेथ है वहाँ होप है, और ये सब है तो जरूर हम जीतेंगे और आगे ठीक होके सामने आएंगे. So you have to figure out your own way to deal with the diagnosis. You learn about yourself, what you are made of. This can be extraordinary, and you want to share with help to others who go through the same things. You are loved, you are wonderfully made, you are beautiful, you are masterpiece. God has a great plan for you. All the best. Bye bye.